on your Friday. I'm Katia Black. I'm one of the founders at MedBio. We're very excited to have Megan back from Strive. And yeah, we will Megan will run through the presentation and then we will hold the last like 15 minutes or so for Q&A. So if you have any questions, there's at the bottom toolbar in Zoom, there's either the chat or there's a Q&A function. Feel free to throw questions in either place. If you do use the webinar chat, make sure to toggle the two so it says to everyone. If people want to start, saying hello, where you're located, in the chat, we love to hear from everybody. And then, yeah, if you have questions as things come up, just put them in there and then we will run through them at the end. And with that, I will pass it over to you.
Awesome. Thanks, Katia. Thanks again for hosting this and having us allow us to present. Like I mentioned before, we are just so excited to bring information about these functional products that we have available. And low dose naltrexone is definitely one that is near and dear to my heart. I've been compounding with it for well over 15 years now. And I just can't tell you how many stories I have heard over the years about, how it has changed people's lives and what it has done for them. And yeah, so just excited to run through some of the applications here with you today. So just quick disclaimer, obviously the presentation is for educational purposes only. It's based off of current literature that's out there, and there is a lot on low dose naltrexone, which is exciting. But obviously patient care is always guided by you as the clinician. And that low dose naltrexone is off label for a lot of these conditions that we're talking about. However, lots of great clinical articles out there too. So with that, our agenda, we're going to go over the origin of low dose naltrexone, the mechanism of action, going to touch on the conditions that it can potentially benefit and do a little bit more of a deeper dive into some of these. I know we talked about weight management last time. We'll just touch on it again, mostly because the dosing that we use for weight management, excuse me, is going to be different than what we're using for autoimmune and inflammatory type conditions. So we'll go over its applications in depression, irritable bowel disease, fertility, fibromyalgia, Hashimoto's, cancer, long COVID, and the neurodegenerative diseases. We'll also go ahead and talk about the dosing, side effects, and then, like Katya mentioned, we'll take questions at the end. So for those of you who might have joined us the previous week, some of these original slides might be familiar to you. You probably saw it, but I think it's definitely worth touching on again. Just the number of conditions that LDN could potentially benefit. Like I mentioned, the autoimmune diseases, because of its autoimmune benefits, multiple sclerosis, lupus, RA, and Hashimoto's. On the chronic pain side of things, with it helping from an inflammatory aspect. So fibromyalgia, neuropathy, chronic regional pain syndrome, with respect to the neurological disorders like Parkinson's, Alzheimer's, ALS, there's some really good data out there that shows it could potentially have some preventative benefits to it by helping decrease inflammation within the central nervous system. We know there are fantastic clinical articles out there showing how it's used in GI conditions like Crohn's, ulcerative colitis, and IBS. Also long COVID and helping with fatigue. The long COVID patients have high levels of inflammation from the spike proteins that they're suffering. So we have seen a lot of benefit with low dose naltrexone in these patients. Obviously, on the weight loss side of things, we know that it can help suppress appetite and control those cravings. Mental health, again, another area where I love to talk about low dose naltrexone and how it can decrease neuroinflammation, which can potentially help with depression and anxiety. And then also fertility. Lots of exciting, just anecdotal cases of low dose naltrexone helping patients who were struggling with issues like a hormonal imbalance or PCOS, and then they were able to conceive after just some short courses of low dose naltrexone. So again, this is just a small smattering of conditions that it may potentially be beneficial for. I think we have logged over 80 different conditions it's been studied in. Over 1,000 clinical articles have been written about low dose naltrexone. So it is widely publicized out there, and we'll get into the nitty gritty with some of these conditions in a few slides here. But again, just to recap the origin of low dose naltrexone. So naltrexone itself was initially FDA approved in 1984 for the treatment of opioid use disorder. And the typical dose that we're talking about here is anywhere from 50 to 100 milligrams a day. This is obviously much higher dosages than what we're talking about with low dose naltrexone. And we'll get into some of the differences between high dose and low dose on some later slides. But it was really in 1985 that Dr. Bernard Bahari, he's considered the original founder of low dose naltrexone. He was the one that discovered that the smaller dosages, generally around 3 milligrams, were having a positive effect on the immune system of his HIV patients. So he was an infectious disease specialist back in the early days of the HIV and AIDS epidemic. A lot of his patients were also on high dose naltrexone because of substance use disorders. Sadly, a lot of his patients were unable to afford their medication. And so what he was finding was these patients were actually breaking up their 50 milligram tablets into smaller dosages. And he noticed that the patients that were taking lower dosages of naltrexone were actually having positive effects on their immune system. So on those B cells and those T cells that are generally negatively impacted by, HIV and AIDS. He noticed that these patients were faring much better than patients taking high dose naltrexone. So he started to do some investigating into why this was. And he started to come across the positive effects on the immune system, and the research really took off from there. So, pretty neat backstory to how it came of being. So there are two different mechanisms of action for low dose naltrexone. The first is the temporary opioid receptor blockade. So low dose naltrexone binds to the mu opioid receptors. These are found throughout the body. So it temporarily binds for about 60 to 90 minutes, and then it releases off of that receptor. Once that release occurs, what we have is a rebound effect, and we have an increased production of endorphins within the central nervous system. So it's important to note that this rebound effect is not seen at the higher dosages of 50 milligrams. It's only seen at the lower dosages. And that's because the higher dose is actually going to sit on that opioid receptor for an extended period of time. So we actually don't get that release, and we don't get that rebound effect like we do with the lower dosages. Again, only sitting there for 60 to 90 minutes. It's important to also note that low dose naltrexone has a short half-life of only about 4 to 6 hours. So it's cleared pretty quickly through the system. But it's this rebound effect and increase in endorphins that is believed to enhance pain modulation. It's thought to improve mood and immune function, especially when it comes to depression. We know a lot of these patients can be endorphin deficient. So, by the process of the rebound effect and increasing those endorphins, we can potentially have a positive effect on the mood for these patients. So these natural opioids also help to remove or reduce emotional eating, sugar cravings, and again, to improve mood and motivation. So you'll see here, it's a dual mechanism of action for low dose naltrexone. The first picture here is the endorphin upregulation. And then the second picture we'll talk about here in a moment is going to be the immune system modulation. So this immune modulation is the second mechanism of action. So what low dose naltrexone does is it binds to what is called a TLR4 receptor. These are found on specific cells, macrophages and microglia. These are immune cells within the central nervous system. They make up about 20% of the immune system, actually. And by turning off the TLR4 receptor, low dose naltrexone takes these immune system cells that are in an active state and turns them over into a deactive state. Now, why that is important is because when these cells have been activated, they will start to release pro-inflammatory cytokines. So tumor necrosis factor alpha, interleukin 6, different cytokines, and these are going to cause inflammation within the body, neuroinflammation specifically. So by turning off that TLR4 receptor and sending that macrophage back into a deactivated state, we are decreasing inflammation. And this is going to be thought to be beneficial in autoimmune diseases, chronic pain, and then obviously those neurodegenerative conditions. You can see here from this slide too, some of the other actions of low-dose naltrexone on things like the natural killer cell, which is involved in cancer. It increases the cytotoxic activity of natural killer cells, which obviously has a positive effect for patients who have cancer. So helping to stimulate the immune system to produce more natural killer cells to go out and find these rogue cancer cells that are out there. Also helping with T lymphocytes and B lymphocytes within the body. It increases proliferation of dendritic cells. So lots of different mechanisms here on all of these cells within the immune system. So one of the biggest questions I get is, what patients are candidates for low-dose naltrexone? I generally say everybody. I think everybody is potentially a candidate for low-dose naltrexone. And the reason is, I think all of us have some sort of inflammation going on. And inflammation is going to be the root cause of any disease process within our body. So anything that we can do to cut down on inflammation is going to potentially have a positive downstream effect, whether it's for these neurodegenerative diseases or someone with an autoimmune condition. So as you can see here, the excellent candidates are obviously anyone with these, autoimmune inflammatory disorders, chronic pain, mental health, cancer, addiction and food cravings or fertility issues. One of the best things is the exclusion criteria. It's a really small category. So it's going to be contraindicated in patients who are using a chronic long-term opioid. And if you remember back, the low-dose naltrexone is temporarily binding to that mu opioid receptor. So it's going to compete for binding of that receptor with an opioid pain medication. So it could potentially reduce the effectiveness of a pain medication for someone who needs it to control pain. So that's the patient population that LDN is going to be contraindicated in. Obviously, if there is significant liver or kidney impairment, we obviously want to be careful too. So just make sure, obviously, that we're, checking our patients and running appropriate labs. But again, I like to say, I think just about everybody is a candidate for low-dose naltrexone. So you might remember this slide if you joined us last week, LDN and weight loss. I'm not going to spend too much time on this. Hopefully you can go back and rewatch the previous presentation that we did a deep dive into LDN and weight loss. But some of the properties for it helping are going to be with appetite regulation. We know that it can influence hunger and satiety, again, by modulating those endorphins and help with the food cravings. We know it reduces inflammation. Obviously, chronic inflammation is huge for a lot of our patients and obviously linked to obesity and metabolic disorders. We also think LDN can help with insulin sensitivity. So a great mechanism there, impacting metabolism through hormone balance. I always recommend, to my perimenopausal or menopausal patients, LDN as a fantastic option for helping them on their hormone balance journey. LDN has effects on sleep, positive effects on sleep. We know that poor sleep is associated with weight gain. So anything that we can do to potentially enhance the quality of someone's sleep could also help them on their journey for weight loss. And obviously, we know that it helps with cravings and addiction like eating, just because it's, we have that, it's used for addiction treatment, obviously, and so beneficial for compulsive overeating and those sugar cravings too. So This is where dosing is a little bit different for weight loss than it is for some of the other conditions that we're going to talk about in a few minutes here. So for weight loss, we're generally going to go with a higher starting dose. So usually about 8 mg at bedtime is where we're going to start, and we're going to gradually increase the dose over about 1 to 2 weeks, potentially up to 8 mg twice a day. This tends to be a sweet spot for most patients. So they're going to get the appetite suppression and they're going to get the craving control, but we're not going too high on the dose. If you remember, I talked about how with the 50 mg dose of naltrexone, we lose a lot of the additional endorphin production, and we also lose a lot of the anti-inflammatory effects. 16 mg, or that 8 mg twice a day, will still allow us to benefit from that endorphin production and anti-inflammatory benefits. So we think that's a good that's a sweet spot, like I like to call it, as far as weight loss goes. So, I think it's important, low dose naltrexone isn't a magic bullet when it comes to weight loss. We've got a lot of tools in our chest right now to help with weight loss, and more that are in the pipeline coming. It certainly can be used alongside of a GLP medication, but just make sure to set expectations for patients that weight loss is going to be gradual with this, and that improvements could take about 3 to 4 months. So making sure that we're decreasing that inflammation. That does take time to reverse those processes. So it can definitely be part of a comprehensive lifestyle program and maintenance for weight loss. But again, it's not quite the magic bullet that GLPs tend to be in our toolkit. Also, it's always important to make sure that our patients are adhering to lifestyle changes, and LDN is definitely appropriate for long-term use. But as with any medication, it's always important to just reassess how the patient is doing, how the patient is responding. But one of the big questions I get is, well, how long can you stay on low-dose naltrexone? There are lots of case reports and anecdotal reports of patients being on it for decades because it works. They notice the beneficial effects of it, and don't want to come off it. And so there's no reason not to continue it long term. So. LDN and depression. So we touched on this earlier when I was talking about the increase in endorphins that we see as one of the mechanisms of action of LDN. So, inflammation, excess body fat, poor eating habits, these all increase the risk for developing depression, and it's a very cyclical relationship, between obesity and depression. So, there's the gut-brain connection. So the excess adipose tissue within the gut and the inflammation that is occurring are sending back inflammatory signals to the brain. So we get neuroinflammation that's happening in there. That can potentially lead to those behavioral changes, that sedentary lifestyle. That's going to lead to weight gain and obesity. And again, we just have this cycle of depression and weight gain that happens. And that's where low dose naltrexone can potentially come in and help break that cycle by decreasing that inflammation in the gut and in the brain, and rebalancing out helping to rebalance out a gut microbiome. So now we are getting positive signals that are being sent to the brain. We know that it helps with immune health. So inflammation is definitely connected to a weakened immune system. Also, we know that it helps with metabolic response. And again, the endorphin deficiency that some patients may have with depression, and that also play a role in other psychiatric conditions. Low dose naltrexone can be of benefit there. So. Low dose naltrexone and irritable bowel disease. This is one of the first areas of study where clinical trials were conducted for low dose naltrexone, specifically with Crohn's disease patients. So there are some great studies out there, patients with mild to moderate Crohn's disease, where this can be used as an adjunct therapy, either standalone or in combination with conventional therapies. placebo-controlled trials showed that almost 90% of patients showed a clinical response to low-dose naltrexone when it was being used for Crohn's disease. I think that's, that's potentially a huge number. Also, the 70% of patients achieved endoscopic healing. And then that Norwegian study found that low-dose naltrexone was associated with a significant reduction in corticosteroid use. So I think this is one of the most exciting places where low-dose naltrexone is being utilized. Also, a good study showing how effective it can be in adolescent patients. I believe the study showed up to 70% of adolescent patients were able to go into remission for their IBD with just using low-dose naltrexone alone. So obviously, we want to try to limit steroid use as much as possible in these patients. So the anti-inflammatory effects that we get from the LDN, as you can see by these numbers, have a huge effect on these patients. So, anytime we hear about a Crohn's or a colitis or an irritable bowel, low-dose naltrexone is always my go-to recommendation for that, to help heal the gut and decrease that inflammation. So LDN and fertility, I think this is a really exciting sphere of use here. I had one of my colleagues that I work with. They had actually recommended low-dose naltrexone to a provider. She was asking if we had anything that could potentially help a patient of hers with regards to fertility. And he recommended LDN to the provider. So the provider started their patient on it. And within 2 months, that patient who had been struggling with fertility was pregnant. So that was a really exciting anecdotal story to hear. We know, the rates of fertility are just increasing in this country for a multitude of reasons. However, I think LDN is potentially a safe option that has a low side effect profile that we could look to as a starting agent versus some other, more involved therapies, before you get to that point. So with regards to immune regulation, like I said, we know low-dose naltrexone reduces inflammation, decreases through that TLR4 blockade. And so the reduced inflammation, helps with sperm quality, with egg quality, with implantation. When you have a lot of inflammatory processes at work in there, it's going to certainly make conceiving much harder. So balancing the immune response is crucial into maintaining that embryo. Again, with autoimmune conditions, fertility changes can be linked to autoimmune diseases like Hashimoto's or celiac. So again, decreasing inflammation there could potentially be beneficial. And again, through that endorphin modulation, supporting well-being and stress. Certainly anytime someone is on, a fertility journey, there is so much stress involved, so much mental stress involved with that. So low-dose naltrexone potentially could help with mood enhancement and help their overall well-being. And then that may potentially lead to, more success down the line as far as fertility. Low-dose naltrexone and fibromyalgia is another area that I love to talk about this medication in. Fibromyalgia can be so complex to treat. A lot of providers and patients, we don't necessarily fully understand what's causing the symptoms that these patients are having, or a lot of providers are still kind of mystified by a diagnosis of fibromyalgia and how do we treat it. I think a lot of times we just give these patients, pain medications, or, we put them on, things like gabapentin to control nerve pain. But low-dose naltrexone has been shown in clinical studies to potentially greatly improve patients' symptoms when it comes to fibromyalgia. So you'll see on that little chart there, 13% of patients actually reported that their symptoms of fibromyalgia were very much improved. 37% said they were much improved, 20% minimally improved. Basically, overall, this pie chart is showing you that up to 70% of patients reported some type of improvement in fibromyalgia symptoms when they used low dose naltrexone. I think that's huge. Again, when we're talking about a condition like fibro, where, we've got inflammation, we've got pain, we've got brain fog, fatigue, having something like LDN that can help patients, I think is, again, another critical tool to have in our tool bag. Hashimoto's, again, another one, an autoimmune condition. It helps to decrease the B and T cell overactivation, decreases those pro-inflammatory cytokines, increases endorphins. All of these things are going to help patients that report the fatigue and the brain fog that come along with Hashimoto's. I can tell you anecdotally, having dispensed low dose naltrexone for as many years as I have, I've talked to several patients that were, diagnosed with Hashimoto's, and, they were right on the cusp of potentially needing some thyroid therapy. They started trying low dose naltrexone, and they were able to hold off on starting any type of thyroid medication because the low dose naltrexone helped to improve their overall thyroid numbers. So I always think that's exciting to hear, that we don't have to necessarily rush to start patients potentially on medication, that there's an option out there that, like low dose naltrexone, that could balance out those hormone levels for them, while also giving them the benefits of improved sleep, improved mood, and that cognitive clarity too, through decreased inflammation. So LDN in cancer, again, another one that I absolutely love to talk about. Excuse me. And we touched on it earlier, how low dose naltrexone can increase the number of natural killer cells within the immune system. And these natural killer cells are the ones that are going out and scavenging the body for cells that shouldn't be there, so namely cancer cells. But really what LDN is doing here is it's blocking the opioid growth factor receptor. And this is increasing the body's own immune response naturally. So by blocking that opioid growth factor receptor, we have an increase in apoptosis, so cellular death with cancer cells. We have decreased proliferation. We have decreased invasion to other organs. Low dose naltrexone can also potentially increase the cytotoxic activity of certain chemotherapy agents, enhancing their, ability to naturally kill cancer, which is also exciting. And again, like we said, it increases the immune response for sure. So it shows strong potential as an add-on for chemotherapy, immunotherapy. Again, and it's again through the binding of those mu opioid receptors. So cancer cells have a high expression of that mu receptor. So LDN is going to really, target those mu receptors on those cancer cells, and that's where we get, we see these the benefits that you see in the slide there. So I think the ongoing research with LDN in cancer is very promising. Again, and when we're talking about something that's so well tolerated, with such a low side effect profile, it seems to me it's kind of a no-brainer to offer this to patients as an option for them to add on to some conventional therapy. This is a little slide that I like to show about the difference between high dose naltrexone and low dose naltrexone, and why more isn't always better. So with the higher dosages, and we talked about that earlier, being around that 50 milligram dose, we do see increased cell proliferation. We have an longer wound healing time. We potentially have more inflammation from higher dose naltrexone. So versus low dose naltrexone, we have decreased cell proliferation with low dose. This is why it helps with autoimmune disorders and also potentially cancer. through, working at that opioid growth factor receptor. So low dose is definitely the key here. It certainly is dose dependent, because we want it to sit on that receptor for that shorter period of time versus the higher dose, that is constantly sitting on that receptor. And that's what you'll see there. It's indicated by the X's. So that high dose is sitting continuously on that receptor versus low dose that is only sitting on that opioid growth factor receptor for a short period of time. So LDN and long COVID, there's some really great articles that have come out over the last few years. Again, long COVID is one of those things. It's a whole set of symptoms and, patients, having a dysregulated immune system, an overactive immune system, even after the virus is no longer detected. And these patients are really suffering. And so we're looking for other things in our toolbox to potentially offer these patients. And I think LDN can certainly be one of those. Again, it's decreasing that inflammatory cascade that may also reduce, cytokines and other markers of chronic inflammation. We know long COVID definitely affects the brain. There is, neuroinflammation that is happening with that. And by LDN turning off those microglial cells within the central nervous system, allowing for a decrease in inflammation, this could potentially lead to help for patients experiencing brain fog, fatigue, headache, sleep disturbance, and also potentially with chronic pain. These patients suffer symptoms very similar to fibromyalgia or chronic fatigue syndrome. And so LDN could offer some potential benefit for them as well. So always good to, like I said, the more tools that we can have in our arsenal that have positive effects on the patient with minimal side effects, they can be game changers and life changing. So low dose naltrexone, neurodegenerative diseases. So we were talking earlier about the microglia. So those cells within the central nervous system. We call these the brain's immune warriors. So microglia make up about 20% of all of the glial cells within the central nervous system. And they act like macrophages. So they go around the central nervous system and clean up debris, or they clean up, injuries, and they respond to inflammatory processes in there. So overactivation of these microglial cells can lead to neuroinflammation. And this is potentially linked to Alzheimer's, ALS, Parkinson's. So again, by deactivating the microglia through the TLR4 receptors, we decrease all of that inflammation, and potentially could have preventative effects. This next slide here is one of my favorite. I know it's very busy, but I always like to, explain it. On the left-hand side, you're going to see the microglial cells. And so we have the resting phase, which is obviously where we want it to be. We have an activated phase, and then we have the phagocytic phase. And you'll see in the middle there the activated microglial cell, and this is definitely responsible for aging, and that great word inflammaging. So aging or inflammation that relates to that increases aging or speeds up aging. And so you'll see that TLR4 receptor there that gets turned off when LDN is in the picture. However, when we don't have LDN on board and that microglial cell stays activated, then you are, moving from the left-hand side over to the right-hand side of this chart. And you'll see this is specific to Alzheimer's disease. So now over time, we have the damaged microglial cell, which is, you'll see increased pro-inflammatory cytokines. We have increased reactive oxygen species. We have the increased tau phosphorylation, and that eventually leads to neuronal cell death. So again, the name of the game here is decreasing inflammation. What tools can we offer patients to decrease inflammation? And again, LDN is a wonderful example of something that we can offer that might have, widespread preventative effects. So the dosing and administration when we're talking about inflammatory control and help with autoimmune conditions, we're going to start much lower for these patients. The goal is to reach a target dose of about 4.5 milligrams at bedtime. So usually we recommend starting with about a quarter of our flex dose tab and gradually increasing the dose every 1 to 2 weeks as the patient tolerates it. We usually recommend doing this slower titration, especially with inflammatory patients or autoimmune patients, because we want to monitor their response to it. We want to, let their body, gradually decrease the inflammation versus throwing that full dose of 4.5 on them all at once. They tend to be more sensitive in terms of their response than our patients where we're using it just strictly as a tool for weight management. So this is why we recommend starting lower with these type of patients and titrating up versus if you remember the suggested titration for weight loss was 8 milligrams working up to 16. So at Strive Pharmacy, we have our fabulous flex dose tablets that we all love. You'll see a great picture there. And I think on the next slide, I actually have an animated picture of this, but they can be quartered. And so it does not require any kind of pill cutter. You can simply break it very easily on a solid surface or just between your fingers. And this makes titration extremely easy. So a patient can just start at a quarter of a tablet and eventually work up to the full tablet. These tablets are composed of the active ingredient itself, naltrexone, and a prebiotic filler that's derived from beets. This is so important because when we're talking about patients that are struggling with autoimmune disorders or inflammation, these patients often have a lot of allergies, whether it's lactose, corn, soy, preservatives, dyes. Our FlexDose tablets don't contain any of those ingredients. They're extremely clean so that we can ensure that we're not going to set off any type of additional immune reaction based off of inactive ingredients within this. So I think that's really important to note. Also, they're suitable for vegetarians because we're not using a gelatin capsule, or for those who have certain religious beliefs that need to stay away from gelatin. So these are suitable for so many different patients because of the way they're compounded specifically. And so here's a great little automated or animated picture of our FlexDose tablet. So you'll see they're just kind of taking their finger and pressing down on it. And I could watch this all day. I think it's such a neat visual of how these tablets work. So we do have the low dose naltrexone available in 4 different strengths, 1.5, 3 milligram, 4.5, and 8 milligram. Naltrexone is also used a lot in pediatric patients. I had referenced earlier a study with regards to irritable bowel disease that showed up to 70% of adolescent patients were able to go into remission with just low dose naltrexone alone. We have seen benefits in patients that have autism, in patients that have PANDAS, in patients that have PANS. So these different autoimmune type conditions that also have an inflammatory response to it. So we do offer the low dose naltrexone in smaller strengths and smaller pediatric strengths. And then we've broken down, you'll see on the chart here, based on the quarter, half, and 3 milligram, what those corresponding strengths are. So again, these FlexDose tablets allow patients to titrate up with just 1 prescription, which is fantastic. Instead of needing multiple prescriptions for multiple different strengths, there's also cost savings that's associated with only needing that 1 prescription too. So possible side effects of missed doses and what do you do if you miss a dose? So LDN is generally well tolerated, but possible side effects could include some mild sleep disturbances, vivid dreams, headache, mild GI symptoms. These generally go away within the first few weeks of therapy, specifically the sleep disturbances and the vivid dreams. A lot of the reason I tell patients this is happening though is because we notice that patients end up spending more time in REM sleep usually once they've started taking the LDN, and this contributes to these more vivid dreams that they're having. So again, that generally does subside over time, but for patients who have poor sleep quality or maybe aren't spending a lot of time in REM, which is that nice, deep, restorative sleep, now that they're spending longer in it, they're noticing these dreams. So I like to tell patients, don't worry, that just means the drug's working. So I've had plenty of patients say they pop their LDN at night and they wait for the movie to start. So there's lots of different ways to look at it, to put a positive spin on it potentially. But also there's the option too for patients who aren't able to tolerate it at bedtime. Maybe the sleep disturbances did not resolve. Maybe the vivid dreams are too disturbing for them. There are a couple options. The first thing I'll do is recommend patients take it earlier in the evening, maybe around dinner time. The other option is they can take it in the morning, but ideally we want patients to take it at bedtime to capitalize on the endorphin production that happens while we're sleeping. There's no need to make up a missed dose of naltrexone if a patient forgets to take a dose. If it has been discontinued and a patient wants to reinstate it, if it's been longer than 4 weeks, then we would recommend restarting the titration. But if they ran out of their medication and they forgot to refill it, they were off of it for a few days or a week or two, there's no need for them to restart the titration over. They can just resume the dose that they were previously taking. This is a question that comes up a lot, what to do if someone is going in for surgery, because we talked about how LDN binds to that mu opioid receptor, and it's contraindicated in patients who are using a chronic long-term opioid. So if you have a patient that's going in for surgery, we usually recommend stopping about 48 hours prior to needing surgery. Remember, it has a short half-life. It's only about 4 to 6 hours. So it's going to be fully cleared from the body within 24 to 48 hours. We do recommend pausing the LDN if a patient is going to be taking pain medication post-surgery. And again, they can restart at their previous dose once they finish taking any pain medication that's been prescribed. And there's only a need to restart the titration if it's been more than 4 weeks. I've also had patients that, went in for emergency dental surgery and were concerned about the LDN, and it's generally not an issue for them. We just like to be proactive and recommend, that they stop it ahead of time, just to make sure that their pain is controlled adequately for whatever procedure that they're having. So we have a couple different supplements that at Strive that we have come out with recently that I think pair really well with our low dose naltrexone. We're very proud to offer these supplements to. They were all created by a pharmacist. They are top quality ingredients, top quality formulations. He spent over a year coming up with these very specific formulations to help patients. And so we're really excited to offer these. And I think a lot of these pair really well with the low dose naltrexone and what we're trying to achieve here for patients. So the first product we have there is our Digest. That's our gut health support. And again, you'll remember that LDN is helpful in those patients that have irritable bowel, helps to decrease that inflammation there. So by supporting gut health, so many good benefits come from that, including improved mood and cognition because of the gut-brain connection that we have. The next is our Regen, so that's our longevity support. Again, I love to talk about how low-dose naltrexone could potentially be used as a preventative agent just for aging and those neurodegenerative diseases. We've got our Restore, which is our sleep support. And like I said, we know naltrexone has the potential to also benefit patients from a sleep standpoint. And then we have our Shield, so our immune support, and certainly supporting the immunofunction of naltrexone and what that's doing inside the body as well. So we encourage you to check out our supplement line, pharmacist designed supplement line that is out there. I think all of these patients pair really well potentially with low dose naltrexone and just living an overall healthy lifestyle. So thanks for tuning in. I'm glad I didn't talk too long and we saved a couple minutes here at the end for questions. So, Katya, I don't know if
Yeah, thank you
you
so
help me
much.
out.
Yeah,
Yeah,
there's been a handful of questions trickling in, so if
good.
people have more, please go ahead and add them to the chat. So this first one is an appropriate dose for a patient with both inflammation and obesity benefited by the titration to the 8 mg, or is it better to stay at a lower dose?
Yeah, honestly, I think it's going to come down to, your patient and what they are struggling with. So, especially a patient that has an autoimmune type condition and then also some weight gain that's associated with that, I would probably keep those autoimmune patients on the lower end of the spectrum, work them up to about a 4.5 mg dose, see how they do there. You can always continue to increase if you need to. I'm a big fan of start low and go slow, especially when it comes to, patients that are really suffering from, autoimmune or specific inflammatory type conditions. I personally I can't tell you how many patients I've talked to over the years that even said at a 4.5 mg, they had appetite suppression, even at that lower end dosage too. I've had patients tell me that their alcohol cravings were suppressed even at 4.5 mg. And especially when we, expect to see that, particularly at the higher dosages, knowing that naltrexone was approved for alcohol use disorder at 50 milligrams. I think it's exciting to see that we can utilize it at these lower dosages, and still potentially have benefits. So yeah, that really comes down to what other, concomitant factors does your patient have going on that are contributing to their weight gain. So certainly if you can get away with a 4.5 mg dose, that would be ideal.
Yeah, there's a couple questions in here kind of about dosages, but
Mhm.
specifically, so LDN, treating ADHD, are there any disorders that like you would specifically for that you would adjust doses? High cortisol, is it a good treatment for that kind of level of inflammation?
Yeah, absolutely. These are definitely ADHD. There's a lot of neuroinflammation that happens with that. I think, especially in ADHD patients, pairing low dose naltrexone also with methylene blue is a great option. Methylene blue, really helps to support mitochondria, decrease neuroinflammation, decrease brain fog. I love the combination of methylene blue and low dose naltrexone together for, so many different conditions and specifically for ADHD. Great clinical literature out there on that. And yes, absolutely for cortisol levels, balancing out those hormones, cortisol hormones, thyroid hormones, sex hormones. Yeah, we're going to be looking at that, working up to that 4.5 mg dosage for all of those patients.
And for patients with ADHD, is there any issues if they're already on something like Adderall or Vyvanse that people should be concerned about?
No, there's no interactions with any of those medications. Naltrexone, low dose naltrexone does not have any type of abuse potential to it. You do not build up a tolerance to it. It's not a controlled substance. So these are definitely, all benefits of the medication. So it can definitely be used alongside of those other, medications for ADHD. And I would, monitor your patient closely. They might actually be able to have a dosage decrease in some of those ADHD meds once you are able to titrate up to a full dose of LDN.
That's great. That's great.
Mhm. Yeah.
Um, and then one in particular, so for people taking over-the-counter drug, and forgive me if I do not pronounce this correctly, 7 hydroxymid granginane. Am I saying that right?
Ooh.
It's the first question in the Q&A chat.
Oh,
Apologies.
okay. Let me see if I can go back and find that. Oh, oh, apologize. I'm looking through some of these where everyone is from too.
Yeah, this one was
Yes.
in the Q&A chat, not the main chat. Uh,
Oh, sorry. Sjogren's syndrome.
yes. Well, there
Yes.
was this one, and then there was another one
Oh,
also
did I
in the
miss that?
Q&A chat. Yeah.
Oh,
I guess
okay.
do that one first, actually.
Oh, okay. Sorry. I'm looking in the webinar chat, so I might be looking at it a little bit different one, but I do see thoughts on use for Sjogren's syndrome. Yes, there are clinical articles out there as well, using low dose naltrexone for Sjogren's syndrome. Obviously, an autoimmune condition. I think that I would absolutely recommend trying a patient on it for that. The sad thing is I could have probably made this presentation 200 slides,
Mm.
to go over all of the applications for low dose naltrexone. That's what's so exciting about a drug like this is I really can't think of anything else that's out there that has so many clinical applications. I think it's wonderful. So yeah, absolutely. Again, clinical articles showing it can benefit patients with Sjogren's, and I absolutely would recommend it for that. Yes.
And
Uh,
then I just posted this other one in the chat for you.
oh, okay. Thank you. Would an exclusion also be for people concentrated? Gotcha. Interesting question. That is something I would probably have to look up. I don't think I have specifically looked into that OTC, but it sounds like it's a concentrated byproduct of the kratom plant. So I mean, obviously I know there's a lot of these, a lot of this has been legalized throughout the country. A lot of these shops are popping up, and basically it's asking for, I guess it looks like the potential for abuse because of its ability to bind to the opioid receptors. Oh, she's posting a lot of information. Interesting. I'll be honest with you, I'm not familiar with that product. I'd have to do some more investigation into it. She said it's terrible and legal and highly addictive. So, yeah, that doesn't sound good. Yeah, I'll definitely get back to you. I'll do some research on that.
Thank you for that. What is the client cost per flex tab?
So we do have our flex tabs uh, priced very well. It's going to be dependent upon if you're getting a 4.5 milligram dose or an 8 milligram dose, and whether you're doing 8 milligrams once a day or the patient has gone up to twice a day. But generally, I like to say just on average, you can get a 90-day supply for well under $100 on the low dose naltrexone. So it is a very affordable product.
And are there some people that are just bad candidates? This question, they have somebody that they have, or she has yet to get anyone on this without significant side effects, even at the super low doses, like headaches, sleep issues, mood changes.
Yeah, they can have some patients can be very sensitive to it. Usually after most patients, after about 2 to 3 weeks, those side effects are going to subside. I tell patients if you can push through it. If you absolutely can't tolerate the sleep disturbances from it, then switch to a dinner time dose or potentially a morning dose of it. Like I say, some low dose naltrexone is better than no low dose naltrexone here. So, I think, and again, it also depends. I'm not sure what kind of dosage she's talking about either. You don't always have to titrate up to the full 4.5 milligrams. I've had plenty of patients that have come back and said, you know what? I worked up to a half a tablet. I feel great here. And I tell them, stay where you are. We don't always have to work up. If you are feeling good and if you're noticing benefits and you're noticing a difference, at even just a quarter of a tablet, then by all means stay there. There's no hard and fast rule that says you have to get to 4.5 milligrams to experience the benefit. I tell patients, base it off of symptomatically how you feel. And that being said too, not all patients are necessarily going to feel something. I like to tell the story of my friend's husband. who he sees a provider, and this provider puts the majority of his patients on low dose naltrexone. So her husband went on it, and of course he ran out of his 3 month supply and didn't feel like getting it refilled. So he just went without it. And about 2 weeks in, he called me up and he said, "Megan, can you refill my low dose naltrexone?" He's like, "I didn't realize how much better I felt on it until I stopped taking it." He said, "I didn't realize what it was doing for me until I stopped." And he said, "I'm not going to go off of it again." So I just thought that was, again, another interesting anecdotal experience that, I tell patients, you might not necessarily feel anything or you might not notice anything. But it's definitely helping from an inflammatory perspective. And then, again, like we've talked about, potentially from a preventative standpoint for all of these other issues that it could have an impact on.
And there's a couple questions about what it should and shouldn't be used with. So you had mentioned opioids, and
Mhm.
there's actually a question in here that her son was going in for a tonsillectomy, and he had been on LDN, and actually the surgeon said it was okay to continue taking it versus going off. And then there's some other questions of, is there any, aside from opioids, is there any other drugs that might have interactions that you wouldn't want to pair this with?
Yeah, no, opioids are going to be it as far as the LDN is concerned. Yes, I've definitely heard that too from patients. Again, because we're talking about such a very low dose of it compared to what the high dose is, and because it has such a short time that it's actually binding to that opioid receptor, it probably is okay for patients to stay off of it. I think, again, that's a conversation that, you can have with the patient or the patient can have with a surgeon prior to going in for something. I think if you want to use, the utmost of caution, you could just tell a patient to stop it a day or two before. Is it going to, cause, any type of anesthesia or pain medication to be completely ineffective? Probably not. Again, remember, we're talking about, doses that are 1/10 of, what is used for, opioid use disorder.
Yeah.
Um, and so I've had also, plenty of patients that, had to go in for an emergency procedure and didn't have any issues as far as pain control or anesthesia were concerned because they didn't stop the LDN ahead of time. I just think, if just again, out of an abundance of caution, we don't want anyone to have anything that's going to, interfere with their comfort going into a procedure. So if it's available for them to stop prior, then that's usually what we recommend.
Yeah. And does Strive provide any sort of dosing guidelines depending on what the condition is that people are trying to treat?
So, again, for most patients, the all of the clinical literature that's out there is showing working up to that 4.5 milligram dose. Sometimes with certain autoimmune conditions, studies were done, they were only using maybe 3 milligrams in a patient instead of the full 4.5. And that's why I tell patients and providers, it's important to reassess, symptoms and reassess the response the patient is having. Again, because if they're taking a quarter of a tablet, and they're a week or two in and they're ready to increase their titration, but they're feeling a huge difference and they're getting relief, then again, there's not always the need to always go up. Like I say, more is not always better. Every patient's different too. These autoimmune conditions are very complex. What works for one patient might not work for another. 4.5 milligram dose might be too high for one patient. They might need to work down to, only 2.25, a half of a tablet, to have relief without, maybe potentially some of those side effects. So again, and that's the beauty of the flex dose tablet. It allows for that titration, either up or down, depending on the patient's response.
Yeah. And does it help with mold toxicity and heavy metals?
I mean, it's not going to specifically detox from mold or heavy metals, but certainly both of those issues are going to cause inflammation within the body. And so I think LDN would definitely be appropriate to use alongside other detoxification protocols.
Okay, that's great. Let me kind of scan through here and make sure we got. Um, you would touch on side effects, but is it common for patients to get migraines when trying to take 2 milligrams?
Yeah, I personally haven't, had anyone complain of a migraine. I do feel like, headache and GI side effects are pretty common with just about any medication that a patient starts to take. Could is there a patient out there who's, migraines, who might have gotten a migraine after taking low dose naltrexone? Was it connected? It's tough to say. I always tell patients, if you think a medication caused a negative side effect in you, stop taking it for, in this case, because it has such a short half-life, stop taking it for 5 or 7 days and then restart back up. And then if you notice that this unwanted side effect has occurred again with restarting the dose, then there's potentially a link between the two things. But just because a patient started LDN and got a migraine doesn't necessarily mean that they're connected.
Yeah. And where does shipping come from for the flex dose tablets? Are you
Yeah.
able to pick them up to avoid shipping?
Yeah, so our FlexDose tablets are actually made on some pretty high-tech machinery that we have out of our St. Louis, Missouri location. So all of our FlexDose tablets are going to ship to patients from there. I'm not sure if we're going to be putting our tablet presses in our other locations around the country, but right now we have them installed in St. Louis, and these are very high-tech machines. We have done a lot of research and development, a lot of testing on these products before, distributing them to the public. We did a lot of potency testing. We did beyond use testing on these. We did, what's called, friability testing, dissolution testing, you name it. We have done all of the things to ensure that this product is high quality, and is going to, work appropriately within the patients. So, like I said, right now we just have these shipping out of our St. Louis location, but perhaps someday we'll have our tablet presses in all locations.
Well, this has been great. I think we covered all the questions. We will be sharing this out afterwards. We'll share out the recording of the webinar as well as the deck. If you end up having any follow-up questions, please, feel free to reach out, and we'll make sure that we get them answered. Megan, thank you so much for joining us again. This was
Thank
great.
you.
We always love having you. We'll be back next week. We have a webinar on Wednesday. We'll be talking about peptide protocols and how to stack them with GLP-1s. And then shortly thereafter, beginning of December, we're going to have InBody back to do a session on body composition.
Great. Thanks so much, Katya. It was nice seeing you. I hope everyone has a great weekend.
Yes, thank you, everybody. We appreciate your time.
All right, take care.
Thanks, guys. Bye.